So just before lunch and after lunch, we're going to run through common mental health problems, signs and symptoms and treatments, and then we'll look at suicide as well. So before we start, we're just going to look at stress management. Equally, it kind of goes back to everything that we were talking about earlier, thinking about our end of life care and COVID and everything that we've been through. So stress exists. So what is stress? So stress can be defined as a mental, physical, emotional, and a behavioral reaction and any perceived demands or a threat. So we're just thinking about a time when we've all been stressed, and you can feel that physiological change in your body. You can feel your heart rate increasing, it alters your breathing, you can feel your muscles tensing and contracting, and it generally goes for that flight or fight thing where you start to prepare. So the fight or flight response is when a situation seems to be threatening us, our body reacts quickly to support protections by preparing to take action. This is the physiological reaction known as the flight or fight response. And this is where our body, and we've spoken about this many times, where we start to feel nausea because it's our stomach emptying, to where we start to go a bit pale because it's the heart pulling the blood back to the center cardiac system, and making sure that we're in a physiological state to respond to whatever the trauma or stress factor is that we can see around us. So what makes something stressful? It's all to do with our resilience levels, really. So we need to think about situations that have strong demands. So I think it's fair enough to say that all of us that work in health and social care work under strong demands. We work under quite time pressures, and it's a demanding role. Situations that are intimidating or things that intimidate us, makes us feel threatened. Life tensions, so things that can be life transitions, so moving from schools, jobs, weddings, funerals, things up to care. Timings, so time can be stressful, so just trying to meet deadlines. Ambiguity, if you're one of those people that like a very clear line, when things are in the grey, that can cause us stress. So lots of things there that can cause us to be stressed. However, not all stress is bad. We are designed to have a certain amount of stress because that's what keeps us working. So stress looks at the overwhelming feeling that is an emphasis being imposed upon us with difficult situations where we feel that there's no light at the end of the tunnel. So examples of distress include financial difficulties, conflict in relationships, chronic illness, or experiencing traumas. So when we're dealing with stress and anxiety or conditions with mental health, it's useful for us to look at the stress factors. If we're looking at stress factors, we're able to kind of think of what we can do there to support somebody. So thinking around social prescribing, thinking about what we can do to help people with stress factors. If you're talking to somebody and they've got financial difficulties, what could you support them with? How can you support somebody with financial difficulties to reduce stress? What advice and guidance could you give, do you think?
Telling them we can find a solution for this.
Yeah, absolutely. The whole point of stress, when we're in that state of an emotional distress and we just can't see clearly, we get that feeling of pending doom. And that feeling of pending doom can go into depression, it can go into anxiety, it can go into psychosis, it can make us feel awful, or it can move us into substances, can't it? We can start taking medication, we could start drinking, we could start to take drugs to try and escape from this feeling of pending doom, this feeling of no light at the end of the tunnel. So with financial difficulties, it's common to all of us. We all have financial difficulties in our life. I don't think any of us can sit there and go, oh, we're all financially secure, because if we were, we probably wouldn't be working.
Okay.
So the reality is knowing some really important things helpful. So for example, things like housing. So if you've got problems with housing, charities like Shelter, you know, there's things that can be done if you've got an eviction notice. It's called a Section 17. You've got debt collectors knocking at your door. Okay, so think about things like maybe an IVA or financial assistance or talking to a charity. Maybe looking at your benefits. So going to a charity like Turn to You, which helps you look at your financial situation, and then they can look at your benefits and entitlement. But there's lots of things that we can do to help people just by giving them that information, supporting them in an impartial way, will not make them feel bad, lift that worry. And equally, removing the stigma about going bankrupt or something where people think it's the end of the world, and actually it's really not as bad as what people think it is. So there's lots of things there. As nurses, as carers, we can say to people, look, we all experience this. There's some advice and guidance here. Always go to the charities, you know, do a refer on and try and get them the help. What about conflicts in relationships? How can we help somebody in conflicts in relationships? What could we advise there? They've got a conflict. Let's say they've got a relationship problem at home, the marriage is falling apart, or they're arguing with their significant other a lot. What could we advise there?
They need probably a marriage counselor to help them.
Yeah, so they may need talking therapy. Yeah. So have you thought about talking to somebody about your problems? There's lots of self-help books out there. There's lots of self-help guides. There's lots of apps. There's talking therapy. There's free counselling services. So it's a case of us saying to somebody, look, again, we've all gone through personal experiences. You know, I'm sure all of us has dumped somebody and been dumped by somebody in our times. You know, it's okay to say, look, I know how that feels. It doesn't feel so great. So just empathizing with people and getting on that level to say, look, I appreciate it's difficult for you. Here's some advice. You know, they don't have to take it, do they? But just saying that there is support there. And if you've had help in the past, what evidence suggests is that normalizing behavior helps people. You know, so if I've had problems in my relationships, I can say, look, I had a problem. This is what I did about it. Because the more we normalize something, the more we don't feel we're failing, the more we feel actually this is a common problem. And for a lot of us, we do have relationship problems. We work long hours, long days. A lot of the time, we probably don't see our significant others. I'm sure you have all been told at one point in your life, oh, you love your job more than me. No, that's not it. It's just I'm committed to my job. It's not the fact that so we've all, you know, we all hear it. And if we spoke about it, we would realize that actually we're all in the same boat. The normalizing behavior really helps, and it helps reduce stress. Then you don't feel that you're wearing that on your shoulders. So excessive obligations. So those people that just take on too much. What can we do to help people that take on too much? What could we say to them?
To have a break.
Yeah, try and have a break. And they're going to go, no, I can't. It's just impossible. So then we need to kind of look a little bit deeper, don't we? You know, why is it you can't prioritize things? What is it you're either avoiding something? Is it the fact that there's a lot going on? Or is it just time management? You just need some help prioritizing things. And actually, when we get somebody to talk about their day, we can hear it out loud. Just by talking about how much we've got going on can help people problem solve. So just helping somebody to problem solve would be useful. What could we do about managing chronic illnesses? So I've got a chronic illness, it's not working, the medication I'm on is not working. What could we say to them?
I think it's acceptance, first of all. They have
so accept the fact that this is a condition, you're going to live with it. And that's a good point. What else could we say to them? about choice.
Well, the choice to have a quality of life while battling
Yeah.
with the condition.
Yeah. So have you networked with people? Have you spoken to other people that's got this condition? Have you looked at different options? Have you, because we know that with most medical conditions, there's more than one treatment, isn't there? So us looking at other conditions, or as Clara said, it could just be accepting the pain, coming to terms with it and finding a strength-based approach, work within your capabilities. Let's look at what you can do rather than what you can't do. So again, just that support there. And what about trauma? So PTSD, and I'm sure, again, none of us have got to this age in life where we've not seen something negative, bad or horrible that's mentally scarred us at some point in our lives. So what could we say to somebody about trauma if seen something that wasn't nice or experienced something that wasn't nice? What would you want somebody to say to you if you've experienced some trauma?
To comfort me.
Yeah, you may just need somebody to talk to, just to offload and just say, look, okay, if you want to talk about this, I'm happy to hear you out. Again, just explaining the fact that what they're feeling, just validate it, it must be difficult for you. And then offer some solutions. Have you thought about talking therapy? Have you thought about speaking to your doctor? And a lot of our role when we're managing stress is to be non-judgmental, because when we're stressed, the last thing we need is somebody to tell us to do something. If you think about it, whenever you're all stressed, if somebody tells you to do something, what are you likely to say to them?
It's not.
Yeah, that's not helpful advice. I don't need that. Yeah. So a lot of what we're doing when we manage mental health and we're managing stress within ourselves, it's all about finding light at the end of the tunnel, finding a solution. Sometimes people don't want solutions. Sometimes people just want somebody to talk to. So it's about just kind of picking up on what that person wants. Are you looking for support here? Are you looking for someone just to listen? One, or are you looking for somebody to listen and give some advice? And then the advice that we would normally give isn't about how to deal with it. It's about how to get some additional help. Because we're not counsellors, we're not experts. Even as a mental health nurse, we don't do that. We would look at all of the options in front of you. Because it's just that thought process, because we're in that constant fighting, we don't have a chance to stand back. So if we look at other forms of stress, and these could be positive and beneficial, we look at things that help us in a more energizing way. They help us motivate. They help us achieve our goals. So examples of good stress be things like passing a course, getting married, receiving a promotion, or changing a job. And all of that kind of goes down to resilience, doesn't it? It's our character building, and again, good stress is what we need in life, because we all need that balance of good and bad. So it's important that when we talk to people about stress, that we look at it in a really balanced approach, that we say to people, look, we all experience stress in different ways and we're non-judgmental. It's about our coping mechanisms around it. And what we need to do is look at resilience. So what makes us more resilient? Why are some people more resilient than others? So, for example, if we look at what's going on in Ukraine at the moment, you've got women who are grabbing their children, who may never have seen anything negative in their lives, who are acting probably more resilient than any of us could ever imagine. What do you think makes that person more resilient?
They are fighting for their rights, I think.
Right, yeah, it's the fight response, isn't it? It's the, okay, I'm going to put all my feelings down. I'm going to keep a very clear head. I just need to get through this. Whatever's going on, we just need to get through this. And that's that fight response, isn't it? So we couldn't imagine what somebody's going through because we just don't know. So we never say, look, I know what you're going through. We could imagine, or it might be useful to say, I couldn't imagine what you're going through. I've got no idea what you're going through. Why don't you tell me? And use that as an opportunity to open up. But the reality is, imagine going through something such as what's going on in Ukraine at the moment. Imagine their resilience level now in years to come. So for them, anything negative has to come up to that level of trauma that they've experienced, or it just won't match up. So their resilience just keeps growing and growing and growing. So for some of us, we've gone through a lot of trauma in our lives. By the time we've hit 40, maybe 45, we've probably had several failed relationships. We've probably had lots of debt come and go. We've probably had lots of disappointing parent talks and those feelings of being up and down. We've probably had lots of highs and lows. So our resilience just keeps growing and growing and growing with age, doesn't it? Because the more we see, the more we get over it and the stronger we become. So a bit like, you know, if you think about loss, the first time we see a deceased person, it's a shock. The second time we see it, it's not so much of a shock. The third time we see it, we're going, let's give them a quick wash and make them ready. Because our resilience just keeps growing. So the more we see, the more that armor goes on and the more resilient we become, in essence. So just because I'm super resilient, I have to be mindful that other people may not be. And that's why nurses get that rap for being quite cold-faced. It's not that we're cold and evil. We've just learned coping skills because we don't want to be projecting our feelings onto you. We know you're a vulnerable person. Does that make sense? So we're holding everything in because that's what we're trained to do. We hold it all in. We're not going to project, but we then get accused of being cold or hard-looking. And that's our resilience levels growing and growing and growing. So if I've got a new member of staff and they come in, and this is a true story, I had a young lady, she was 18, it was her first day on the job, and she cracked her nail, and she sat on the floor and burst into tears. And I was like, mate, I have no idea what I'm going to do now. And I said to her, you know, what's going on? What you know, and she told me, she said, I've cracked my nail. And I was like, I cannot believe that was the first negative thing that's happened to her. For her, that was the end of her world. Her resilience was so low, she'd never done a day's work, she'd never experienced any loss in her family. She lived in a really protective world, but for her, that resilience was so low. Now, my response to that could have been, don't be so silly. And I had to stand back and go, hang on a minute, this is your coping skills. You don't have any. Because she hadn't been exposed to anything. So it's about when we talk to other people, we have to accept that we all have different levels of resilience, all different levels of stress. So what I find stressful, or what I don't find stressful, sorry, you lot might find incredibly stressful and vice versa. And when you think about it, if you're working in an A&E, probably one of the most stressful environments of health you could work in, you need to be pretty resilient, right? You need to be thinking, you need to be working as a team, you need to be parking those feelings because you have no idea what's going to come through that door. The more you learn, the quicker you train, the more resilient you become. If you put maybe somebody from shopping, you know, somebody from Tesco's and they come to work in your homes, they probably die on the spot when they realize how hard you work. Because for you, you're so used to the world in which you work in, your resilience is way up there. It makes it really hard for us to mentor other people or to be compassionate because we tend to go, what's the matter with you? You know, because you're used to doing 12 to 16 hour days. You're used to seeing people dying and end of life. We're used to dealing with vomit and feces. That's our world, isn't it? If you're not from that world, it can be quite intimidating, can't it? So we just need to be mindful that when we're dealing with stress, that we don't compare people to ourselves and that we're accepting the fact that resilience levels can be different. I did cover that. So stress responses. So when we have an example of stress or a situation, people say, for example, taking a test, if you find tests taken to be stressful, you might choose certain physical, mental, or emotional responses. So if you think about you going in an exam situation, what do you think your physical response would be? What happens to your body when you go into an exam?
We are nervous and
Okay, so nervous would be an emotional state. What would be happening to your body if you're nervous? What would be the actual sign? What would you see with nerves?
Bug on your tummy.
Okay, so you get a physical response in your stomach. So that's the body going into fight mode. That's the stomach saying to the brain, I need to empty because we're going to fight. Okay, so that's one. What else might you see?
Your hands.
So you might start to shake, mightn't you?
Yes.
Because that's a physical response. We can see that. Okay. What else might happen? What happens to your heart rate?
Palpitations.
So you get palpitations. Your heart's going to start going faster. So if your cardiac is increasing, what happens to your lymphatic system? What's happening to your body if your heart's increasing?
Your bladder, so you go to the toilet much more often.
Okay, so you may want to urinate more, you may want to go to the loo. What else happens to your body? So you might perspire, sweat. Actually, when we think about physiological response, quite a lot there for us to pick up on, isn't there? Increased heart rate, thirst, sweat, shaking, dizziness, that feeling of passing out, emptying your stomach and all that lot. What does your behavior look like then? What am I going to see? You going into an exam, what will I see?
Agitation, lack of
Settle.
concentration.
Yeah, okay, good. What else? I'm sure I'm going to see this all when I come out and do your OSCEs, so.
You're very worried.
Okay, so that behavior of panic, so our whole facial structure changes, doesn't it? We find it very difficult to smile. You know, none of us walk into an exam room, unless you're Hermione Granger from Harry Potter, but none of us go into an exam room going, oh, I'm looking forward to this. We all have that sheer look of dread, don't we? We get that, we start to pace. We get that change of maybe we start to tap something, we start to distract our minds, we start to not necessarily give good eye contact, we start to kind of go quite inward. Okay? So what's happening in our brains when we're going into an exam? What's the first thing we say to ourselves normally?
We can do it.
Okay, that's a very positive response. Okay, good.
I forgot everything.
Yeah, okay. So again, we can either go for positive or negative. We can either try to do that good self-talk and build ourselves up, or we go the other way and we start to assassinate ourselves. I haven't learned it. I don't know it. I'm going to fail it. So again, that changes our mental state. So then overall, our emotional state now, what are we now looking like? Putting that all together.
Stress. Right.
Yes.
Yeah, we are now looking stressed and anxious and worried and drained and all of this behavior. So when we think about mental health, we're looking for all of these. We're looking for the physical, the behavioral, the mental response, what's going on in the mind, and their emotional response. Actually, when we start to piece that all together, we can help somebody for signs and symptoms, because if we can see somebody is maybe really dry lips because they've gone really dry, look, why don't we sit down and have a drink? Because your heart rate's increased. Let's sit you down. What do most people do before an exam if they're a smoker or they drink coffee? Normally go outside, have a cigarette and drink a coffee. All of that's going to increase the heart rate. So now before you go into the exam room, your heart is going faster and you can feel that heart bumping in your neck because we've naturally increased our physiological response. So our job is to recognize stress responses within ourselves, because that will keep us calm. So if we know that we can feel our heart beats, if we can feel that dry mouth, if we can pick up that stomach feeling, that's our subconsciousness picking up on that there's a problem ahead, and we can kind of clear our minds and just calm ourselves down. Because if we're stressed in an emergency situation, we can't deal with it. And it's as simple as that. We'll make the wrong decision. We don't see clearly. We can't think clearly. You recognizing your stress responses is really important, because you can put yourselves into a good place. If your heart rate's going up, maybe you're going to have a glass of water and just sit down for a minute. If you can feel that your behavior is altering to this panicky pacing, maybe some deep breaths will help. You know, if in your mental state you're going, I can't do this, I can't do this, maybe you need to move that to, okay, let's do some good self-talk. I can do this. I'll be all right. I need to ask for help. And if your emotional response looks like fear, then that's what you're going to be projecting. That's what people are going to see. Equally, recognize this in your colleagues. So when we are working with new members of staff, we should be looking for their stress responses, not just because it's the right and ethical thing to do, but because the law says under the Health and Safety at Work Act, we should be working in a stress-free environment. We shouldn't be naturally exposing people to high levels of stress. So what's stressful to you? We've already covered this about resilience. Again, there's lots of things that state the most stressful things you can do is start a new relationship, move home and a new job, and getting married. They're all up. Moving house, I think, is one of the most stressful things you can do. Then obviously there's other things there. So we need to recognize that what stresses one person out doesn't stress another. So that's that resilience thing that we've talked about. Why do we stress out? So two major reasons. We perceive a situation as dangerous, difficult, or painful, and we don't believe we can cope or have the resources to cope. So that's why if we say to ourselves, we can do this, self-talk, that positive self-imaging, we kind of remove that bottom one that we can't do it. A lot of people in exam situations will go, I can't do it, or I've forgotten it. It's like, well, your brain hasn't just emptied. You may freeze for that minute, but actually when you stand back and think, you'll be okay. And when we do your Roskies, I'm sure some of you will panic, but it's not what I'm assessing. I'm assessing, can you do the skill? I'm not assessing you as a person. I'm just saying, can you do that skill? You know, you'll have a practice, and during your practice, we'll be watching you and we'll be doing it together. I don't want any of you to say you can't do it. That's not a word that we use in our vocabulary. And when we perceive a dangerous or difficult, painful situation, I guarantee you this, when I get you to take blood for the first time, because you'll all be taking blood from me in my arms, I guarantee you'll all shake and that needle will be all over the place. Then once I've steadied your hand, it normally goes in okay. That's because we're going, oh my God, I don't want to hurt him. He's watching me, he's judging me. And that nerves kicks in. That's just our dangerous perception. The reality is I wouldn't let you take blood from me if I didn't think you could do it. So I will have watched you have done it on the arms a couple of times, because actually I think the best way to take blood is on a live person. It's no different to the first time that I gave my first injection. My first injection, how I even hit their arm, I don't know. I was shaking so much, it could have gone in their forehead. But once I got over that first one, I was like, oh, this isn't difficult. It's fine. It's easy. And that skill in my head, I built up to be such a difficult thing, I realized it wasn't. And then the penny dropped and we progressed quite quickly. So for you and your Roskies, nothing you're going to do is dangerous, because 95% of it you're going to be doing on a dummy. And then the 5% you're going to be doing on me. It's not dangerous because I wouldn't let you do it if it were. It's not difficult. None of what you've got to do is difficult. They're very simple skills. They just look difficult because you've never done them. Once you've done them and that nerve comes and goes, it's fine. And then there'll be no stopping you. You'll all be running around with needles wanting to do everyone. But remember, clinical supervision. And obviously, just make sure you watch the videos beforehand and just say to yourself, I can do this. You know, I think you'll all be surprised how much you can do by challenging yourself. So we need to look at warning signs. Our red flags are our own warning signs. It's what pushes us to achieve. Because again, if we didn't have the good and the bad, we wouldn't push ourselves harder. So red flags are really important for warning signs that stress is creeping on us and our lives are slightly going out of control. So look for the behaviors in which you do. So it might be the fact that you isolate yourself. It might be the fact that you start to become negative in your mind. Look for those red flags and then look for solutions around them. So making sure that you're working with that. So ways of reducing stress is find a support system. So we all need a support system. That's why we have clinical supervision at work. That's why supervision and appraisal is so important. That's why after a de-escalation from an assault or challenging behavior, we do de-escalation because that's our support system. And that's why at end of life, we have a debrief because that's our support system. So at work, we have naturally built-in support systems to manage our stress levels. And equally, if you do feel your anxiety is going up, identify ways that you can manage that. If you're not a talker, there's apps such as Mood Tools, Mood Juice, there's an app called 7 Cups. There's loads of apps on your phone which are really good. So if you're not a talker, you can manage it yourself. Change your attitude. So think about the situation. Life is 10% of what happens to us and 90% is how we react to it. I quite like that. So just think about, is it your inner voice going, it's the end of the world, I can't do this, I want to sit at the end of my garden and eat worms? Or have you got a positive voice in your head saying, look, you can do this, just take a deep breath, you can do this. So just think about how you project. And negative people, it can be really hard for people that are quite negative. So if you're talking to somebody and they always see the worst in everything, this can be quite difficult. For us in social care, we have a rule and it's called hope. Because with hope, anything can happen, right? If we've always got hope, we can improve people's lives, we can improve outcomes, we can make differences. And that's why I've got a tattoo on my arm for hope, because it's one of our underlying principles in nursing. So my first thing is, all right, life sucks, but we've got hope. And then I can move forward and build on that. So just think of your mantras, think of the things that you can say to yourself. In counseling, it's called self-talk. Get yourself some self-talk phrases. Realistic, so set yourself practical goals when dealing with situations, and obviously develop realistic expectations for yourself and others. So if you have got somebody who finds change quite difficult, then be realistic on what they're going to achieve. But again, go strength-based. Look at what they can do, don't look at what they can't do. You know, celebrate the fact that they survived a situation rather than the fact that they could do better next time. You know, so look at the ways in which we work. Get organized and take charge. So again, time is one of our biggest factors in life. It's one of our biggest stress factors. We have the same time as everyone else, but it's important that things that are important to us, we plan, we allow enough time, we're not getting ourselves frustrated. How many of you are angry if you're late to an appointment? Any of you get angry if you're late to an appointment? Or frustrated? Frustrated. What about when people are late for work? You get frustrated or angry then?
Both.
Both. Yeah. And again, I like to think I try to manage my time effectively, and therefore I expect people in my team to do the same. And it's good to have those conversations. It's good to say to people, you know, if they're running late, you know, this has a knock-on effect to everybody, because you can plan your time. If other people aren't doing their fair share, it can have that knock-on effect, can't it? And again, causes major problems. Take breaks, give yourself time to relax. So look at ways in which you can regenerate and look at relaxation techniques. So during your day, we can try a bit of mindfulness. We can do a 10-minute power nap. You know, if you are in a long day and you've got that, can you go out and get fresh air? Can you just go for a walk around the garden? Can you take in some deep breathing? Can you do something that just increases your heart rate for a few minutes? You know, what can you do to improve yourself? Because I would probably say most of us are terrible at looking after ourselves. We're very good at looking after everyone else, but we're at the bottom of the pile. And actually, we need to push ourselves to the top. Equally recommending that to others. Taking good care of yourself, so eating properly, take regular exercise, all of that routine stuff, which I know you all know, and I know in our jobs it's quite difficult to do that. Obviously, you know, as I was just saying, just find that time in that day. Look at what you can do. Learn to say no. That's a useful one. So again, if you are one of these people that are always at the first in line, and you tend to feel that you're taking on too much, it's probably because you can't say no. Oh, can you do the shift for me? 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 The reason they keep asking you is because you're the one that goes, yeah, I'll do that. Yeah, see, we're all smiling because we all do it. So again, it's learning to say no, and then not feeling bad because you've said no, you know, making sure, because again, you need to keep your stress levels right. Get regular exercise. To be fair, you lot get regular exercise. You're running around those homes like there's no tomorrow, I'm sure. Get a hobby or do something different. My hobby confuses everyone. I study. I like to study. I like to learn. That for me is a hobby. For some people, they're like, that stresses me out. So for you guys, it's whatever you're going to do as your hobby. But it is useful for something. And to be fair, I tend to say rather than a hobby, just something that's going to distract you. If you can do something that distracts you. So for me, reading a book or reading an article on health or just writing an essay or something, it's different. It's just different from my normal day. So it's a distraction. Slow down. So know your limits, cut down on the number of things you try to do each day, be realistic, monitor your pace. So let's then look at task-orientated care at work. You know, care is 24 hours a day, 7 days a week. It doesn't all need to be done on your shift, does it? Laugh and use humor. You've probably picked up that I have a dreadful sense of humor. I try to make people laugh. I try to make myself laugh. Normally I think afterwards and go, why did I say that? I think at the time I thought it was funny. Works. Actually, humor is really important. When we laugh, we release the serotonin and the dopamine in our brain. It lifts us, it lifts our mood, and it actually does put us in a good mood. When you think about it, our job is tough. We see a lot of negative stuff all day long, don't we? So laughing is the key here. So making sure you can use humor. Obviously learn to relax, meditation, and relaxation techniques. The two are deep breathing. And that's where you breathe in for 4, out for 5. So you breathe in for 4, but you breathe out for 5. The reason we breathe out for longer is because in our lungs, we're using the bottom alveoli and bronchial tubes in our lungs, and that clears, it gives us a better oxygen level. So when we are feeling stressed, a minute of deep breathing can help re-regulate the heart, it can help re-regulate our oxygen levels, it can help with those negative thoughts. And visualization, visualizing ourselves in a place where we want to be, a really good distraction technique, because we just want to take ourselves out of that stressful situation for a minute, and then we can come back. Because if we've got anger or frustration going on in our minds or stress, we can't see clearly. And equally, these are great techniques, not just for you, but for the people you work with. So if you see somebody that's their nasals are flaring up and you can see their little heartbeat going in their carotid pulse, say to them, look, I think you need to take 5. So stress management next steps, we need to try to change the way that we use appraisals in situations to make them less stressful. So supervision and appraisals should not feel stressful. They're meant to be uplifting they're meant to feel validating, and they're meant to feel quite motivating. So if you go into a supervision and you feel stressed, that's not supervision. Okay, it's as simple as that. Supervision in health and social care terms is an opportunity for the carer to let off steam, feel heard, to feel validated. It is not a performance management tool. It is not a time when we sit there and go, you were late on 3 occasions, or when I went into Margaret's room, you didn't make her bed properly. Okay, that's not supervision. Supervision is an opportunity to discuss your thoughts, your feelings, and to be uplifting and motivating. If you want to bollock somebody and tell them off, that's a performance management meeting. If you mix the two up, you then have people going into supervision negative, and you don't want that. You want to use supervision as an opportunity to offload, get all of those feelings out, explain the frustration that's going on in your mind, and you want to use performance management meetings for behavior. Okay, so performance meetings for behavior, supervision for managing staff's feelings. Because we all get stressed and we all need an opportunity to let that out and to talk. We need to use coping skills in different ways to reduce stress, and we need to look at different relaxation techniques. Okay, and there's some references there. Okay, so that's stress and anxiety. Any questions on stress? No, are we happy with that? Okay, so I've just, is it now 12:30? Have I just, is that the time? I haven't got a clock in front of me.